and I've seen some really traumatic things, but I had never seen what had happened to me. I said it. I told them I was dying. I knew I was dying. All the things I was going through, I was like, this is it. This is what I was worried about. I fought really hard to stay awake because I could feel like tingly and all that stuff. And I was like, oh, this feels really good. I should just go to sleep. And I was like, Mina would cross my mind. And I was fighting so hard to stay alive that I couldn't pass out. We were just in the right place at the right time.
Yeah.
Wow. And all the right people were working that day.
All right, so today I'm joined by Nicolette, who is a mama friend I met through Instagram. If you missed the last episode, definitely make sure to go back and listen to it. We went through her I had no idea moments throughout her pregnancy, birth, postpartum, and today we're going to be picking up right where we left off. Also, as an added bonus, we'll be sharing her unique perspective, both as a healthcare worker and a patient herself, on ways that women can be a strong advocate for themselves when navigating the healthcare system. So we're going to dive right in and get started.
A few days later, I was at work. I had a patient. I discharged her and I just felt like really like wet. And I was like, oh, I must be like really sweaty. That's gross. And I went to the bathroom and I like pulled my pants down and there was just like blood. And I was like, what the heck? You know, like it was like more brown than like bright red, but like it was a lot, enough where I was like, my heart started pounding and I was like, something is not right. Like this might be a precursor, like I might be losing this pregnancy. So I was like hysterically crying. My hospital has an emergency room that's separate just for pregnancy and postpartum. So I just went downstairs to OB-ED to get checked out. And, you know, everything looked fine. My fluid levels were great. I wasn't dilated. Alek was moving. They just were like, it could be that you had a subchorionic bleed. And your body just dumped it, you know, like just old blood and just dumped it. So I was on bed rest for like 5 days and every day the bleeding was like lighter and lighter. But like I said, it wasn't like, it was old blood. It was like brown, not red, but it still was like scary because you're like, this could, you know, lead to something. So I remember like I kept a journal for both my pregnancies, for both of my kids. And for Alek, I remember I was like begging him like to stay, you know, like, please don't leave, you know, like we just told your sister, because now it wouldn't just be our loss, it would be her loss also. And I don't know, you know, how she would handle that because she was so excited, you know. But that resolved and nothing. And then I was like, yeah, I'm having contractions. I don't know. But I wasn't, like, I went to the doctor and he was like, nope, you're not dilating. I'm like, I know all the signs of like early labor. I'm like, I'm not bleeding, like all this stuff, like check if I'm dilated, but like, I'm not super concerned because I'm pretty sure they're Braxton Hicks, but they're intense, like enough where sometimes I'd be like, ooh. So that was completely different because I had never felt that.
And when was that? How far along?
Like I was like 16 weeks.
Oh, wow. Yeah.
I mean, like weird. My belly would like be misshapen. They were strong. They were strong. I remember there was a code 9, which is like, you know, if there's a shoulder or something, like a baby gets stuck. We call a code 9 and I was running with ice because they usually do a cord blood gas on the baby once they're born to see what their like their blood levels are and the acidity of the blood and whatnot. And it needs to go on ice. So people always forget to get the ice. They're like, get ice. And so like I heard the code 9. So I ran to get the ice and I was running back to the room and I couldn't run because like the Braxton Hicks had come so strong. I just like held the ice out and was like going like this and like holding my belly like take it.
Wow.
But you know, that's just what it was, like Braxton Hicks. And I was like, oh, this is going to be a fun labor if I'm feeling this already, you know?
Did that continue throughout?
Yep. All the way.
Oh, wow.
Yeah.
Wow.
I have like pictures of my belly like lopsided and I'm like, I'm not in labor. This is just my Braxton Hicks. Like they're crazy.
Wow.
Yeah.
How often would you get them?
Depends on my level of activity.
Oh, okay.
So there was one time where one day where I was like right before my my induction date, I was like super busy all day. And I thought I was in labor until I like stopped. I sat in a bath, I hydrated, and then it was gone.
Okay.
It's like, dang it. But also good thing, that I wasn't. But yeah, so, it was fine. And then every time I went to the doctor, I was long, closed, high, like no signs of me having a baby anytime soon. And I was like, what the heck? My body just really likes being pregnant. Doesn't want to let go of those babies.
Yeah.
I mean, even with my miscarriage, like my body is not what expelled the baby. Like that's not how I miscarried. I miscarried, like I went to the doctor and there was no heartbeat anymore. So,
Okay,
and then
gotcha.
they waited for something to happen, but my body was like, nope, we're still pregnant. So I had to like have it removed. And yeah, so I had complaints of like random gas pains or what I thought were gas pains, because they just would come and go on my left side. And I told my doctor, like, I just get these, like, everything's fine. I just get these like random stabbing gas pains like every now and then, but no big deal, So my induction night was like super fine. I was like contracting. I was walking the halls. I was doing all things, hanging out at the nurse's station with my coworkers, like I did not sleep. It was terrible. But the next day, I don't want to get like too crazy into what happened, because like you said on your thing, like I've done it on other podcasts.
Sure.
It's really long, and anybody that's interested can go over to those podcasts and listen to that story.
Yeah, I'll link it below so
okay,
everybody
awesome.
can check it out.
Thank you.
Yeah.
But like with that intuition that I was telling you with that dream I had about being pregnant, like starting close toward my second trimester, I had that feeling I was going to die in labor. And I like told anybody that would listen, like, I'm really afraid I'm going to die in labor, but like I was super healthy and my pregnancy was super healthy. And apparently I was having symptoms. I just didn't know that they were symptoms because they were so vague. And you really don't know unless you catch it incidentally on imaging, which didn't happen, or the rupture happens, which is what happens to me. So I think what caused it, looking back, would be I was bolusing for my epidural when it happened. Like
You were what?
I was bolusing for my epidural. So a liter of fluid was just like flowing in super fast. And I think that like extravascular pressure is what made this aneurysm rupture. So briefly, for those who don't know my story, is I had unknowingly developed a splenic artery aneurysm during my pregnancy with my son. I had no idea. There were no symptoms other than those pains I was getting on my side, which were, like I said, felt like gas pains. So I didn't think anything of it. I am like a seasoned labor and delivery nurse. So I, was all the thing, my blood pressure was fine. Everything was fine. I just had that like impending doom feeling for a good majority of my pregnancy. So I was standing ready to get my epidural when my artery ruptured. And so with that, I was bleeding internally very quickly, deteriorated very quickly. My son's heart rate went down very, very low. I was rushed back for an emergency C-section under general. And he was given a very poor prognosis. He was intubated, sent straight to NICU for brain cooling. And they had to figure out what the heck was going on with me. So my OB, who is amazing, he got my son out in under a minute. From time of incision to birth is the same time. And he called trauma. He made all the right calls at the right time. They opened me up all the way up above my belly button. And because of this one resident in the room who was like, I read an article and it sounds like this, check her spleen. And because when they opened me up, there's blood everywhere. So they had to like pack and like,
oh my
blood pressure was tanking, obviously, because like I'm losing blood at such a rate. It's an artery. I think they say like for an aortic dissection, you have like 6 minutes before you're dead. So I would assume that would be the same for a splenic artery. But I think being pregnant and having Alek inside when they laid me down kind of like tamponaded the bleed. So it allowed, for certain, because it took a total of like maybe 25 minutes from like rupture to like finding it, maybe. I'm not sure. But yeah, they found it. They took my spleen, the tail of my pancreas. And I had some more bleeding that they couldn't figure out what was coming from, but it looks like I just had like a serosal tear. So it was like little vessels on my stomach that had like ripped off that they had to like just press until it clotted, and it was fine. And that was that. I was intubated and sent to the trauma ICU. My son was in the NICU. Serge didn't know what to do. who to be with, you know, Mina's home. I mean, it was just a mess.
Yeah.
And not obviously the experience that we thought we were going to have.
Mm-hmm.
And I always get so like sad when I think about how it was supposed to be.
Yeah.
And then what it was. And I know the things that can happen.
Yeah.
And I've seen some really traumatic things, but I had never seen what had happened to me.
Yeah. Yeah. It sounds like the only one guy knew what was, or like thought he knew what was going on.
Yeah.
And it's not very common, right?
No. And survival is very poor. Mortality rate is very, very high. It's 95% for babies.
Wow.
And 75% for mom, because most of these ruptures are happening when people are home and they're not in the hospital.
Oh, okay.
So,
oh my gosh.
There actually was another doctor that's part of the practice that I go to who had seen it in her residency. And she just so happened to be on that day and she came into the OR. And I remember when I returned back to work, she looked at me like I was a ghost. She said to me, "You did so much better than the mom that I saw." And I was like, "Oh, what happened? Did the baby die?" And she said, "No, she did." And I was like, "Oh,
oh my
gosh. All right, well, I'm going to go into my patient's room now."
Yeah.
You know? I know that was my reality. I said it. I told them I was dying. I knew I was dying. All the things I was going through. I was like, this is it.
Yeah.
This is what I was worried about.
And were you like, did you like pass out then?
I didn't. I lost my vision.
Oh, okay.
Yeah, I couldn't see.
Wow.
Like I was looking in front of me and I like couldn't see. And it just looked all like pink and pixelated. And I just started to get like really weak and I couldn't move and I couldn't like talk and everything was such an effort. And I just like laid there while they were like moving me around because I couldn't even move.
And you didn't have an epidural at that point?
No. Right, and I always wonder if I had gotten it and then it ruptured, would I have felt it?
Right.
I don't know. But
and how far into the birth was this that when it happened?
I was 3 centimeters.
Okay.
Which even bothered me when they checked me and I was 3 centimeters. I was like, Mina was born already. What is going on? You know, what is happening?
Yeah.
Yeah, I was like 3 centimeters and it was wild. I fought really hard to stay awake because I could feel like tingly and all that stuff. And I was like, oh, this feels really good. I should just go to sleep, you know? And then I was like, Mina would cross my mind and I'd like, no, I like, you know, and I was fighting so hard to stay alive that I couldn't pass out, if that makes sense.
Yeah.
A lot of it has to do with the up and down too. If I was laying down, I wasn't bleeding probably as much. And if I sat up, I would bleed.
Sure.
And Alek was in there kind of giving this kind of like plug, which was helpful.
If you're enjoying this episode so far, please take a moment to subscribe and hit the bell notification so you get more episodes like this in the future. So what is it that makes it so that the baby has such a poor chance of, you know, survival or whatever?
So the baby's getting oxygen and blood from your placenta. And so there's like different ways to interrupt that flow. So essentially when my artery ruptured, like I'm not even getting circulation anymore. So it's not going to the baby. So baby is now therefore oxygen deprived. And if they do survive, a lot of the times they have brain injuries.
Gotcha.
So he happened to meet the criteria for brain cooling because he wasn't breathing when he was born and his heart rate was very poor. We have a level 4 NICU at my hospital. It's the best NICU. And we have Arctic Sun, which is the cooling. And we were just in the right place at the right time.
Yeah. Wow.
And all the right people were working that day. There were so many hands in our survival, but I like to call out just a particular few because they're like my team, you know?
Yeah.
Yeah. So he was in the NICU and he was cooled for 3 days. And then I was in the trauma ICU. And like I said, the other podcast, I go into like how it was when I woke up. It was hard because when I was put under, I was convinced that he was dead because I was acutely aware of how much time had passed. And I was like, he's not alive.
Yeah.
So when I woke up, it kind of was like, what happened? I had to like be reminded, like, you were here to have a baby, you know? And then I was like, right, the baby, you know, like I had no attachment to him at all. Cause I was like, he's dead. So I'm not even bothered because he's not here, you know? And then hearing that he was alive was like, what are you talking about? I was like, oh, okay. So you're telling me about him because you're keeping him alive and I have to go see him. And then you're going to pull the life support and he's going to be dead. You know, like these were all the things that were going through my mind. That postpartum was the worst.
Yeah.
Like the absolute worst. Between the post-surgical abdominal infection I developed, the subsequent surgeries, that was super traumatic because it was like, why are you so, why are you, we have to do surgery. Why are you freaking out? Oh, because, you know, I was dying the last time I got put under general. So, you know, am I going to wake up? I don't, what the hell? The fighting I had to do with the trauma staff to like listen to the things I was saying, like as a healthcare worker that worked at that hospital was like, you're kidding me right now. Like that you're not hearing, like, I'm not just a body.
Right.
I'm a person. And like, I may not be a doctor, but what I know more than you is my body. And I'm telling you, one, I'm developing an infection. And two, the antibiotic you gave me, I had an allergic reaction to. They're like, no. But
oh my gosh,
I was right for both. Alek got discharged after 6 days and he was given a clean bill of health, which in and of itself was just, I mean, his survival in and of itself was a miracle. And then they gave him a clean bill of health, which was like like double miracle. And I just was like, something's wrong. Like something's not right. I was like, why? I'm like, why is he fine? You know, like it doesn't make sense. Why is he fine? And I couldn't wrap my head around that, like, he's okay. And it took me a really long time, maybe like over a year, to be like, my son is okay. And I could like breathe. I don't have to like worry, you know?
The anxiety alone that would come from that. Oh.
Yeah. I was discharged after 2 weeks. I had like a midline in. I had 3 drains hanging out of my stomach. And they're like, here's your baby. Go have fun. And I'm like, I can't stand up straight.
Oh my
and
gosh.
I want to die. And I don't even care that I had a baby, but thanks. No problem.
Yeah.
You know, like,
yeah. Oh my gosh. Yeah. So how was it when you got home?
It was awful. It was really awful because I could barely take care of myself. I couldn't take care of him. And and Serge had to go back to work at some point. And I was so dysregulated. My son was so dysregulated. I was like, I hate this. I hate this. I hate being a mom, which was like so wild because I love being a mom. Like I love being a mom so much. It's like the greatest thing I've ever done in my life was being a mom. You know, like this is just like a different like layer to life that's like so meaningful and like so purposeful. And I love it. And then here I was like not liking my son and like not liking myself. And I was like a shell. And it was like bad. And the breastfeeding was just, oh my God. He's like, he was a psychopath when he ate. My nipples didn't stand a chance. He would eat so much. And I just, between the severe blood loss and the C-section and everything else, I just was like not producing enough. And they had already started supplementing when he was in the NICU, even though I was sending down like enough colostrum, like I was pumping, I was making a lot because he was sedated for 3 days. So I had 3 days of supply to send down to them that was filled with drugs.
Right.
You know, like, but they were monitoring him. So it was, you know, they were fine with giving it to him, but like they gave him a bottle and I was just like, what the heck? You know, like I know he's got to eat, but like I'm sending you stuff and like, I don't like that. But it was necessary. It's just that I had a successful breastfeeding journey with my daughter. So why wouldn't I with my son?
Right. Yeah, it's funny how like you can have totally different pregnancies, totally different births, totally different breastfeeding journeys. Like I had the same kind of thing, totally different. From the first to the second. My first was just, it was terrible. The second was not great, but it was better and, lasted longer. And yeah, you can have totally two different experiences. Yeah, and you had the PTSD and birth trauma on top of that.
Yeah.
Um,
That was
uh,
such a fun time.
yeah. Oh
It
my
was really
gosh.
hard, and for my mental health, I made the decision to stop breastfeeding because it hurt. I couldn't nurse
Oh
him
yeah.
in the positions that I liked because the drains that I had hanging out of my stomach, I couldn't use my boppy. I was in so much pain. I already felt like the biggest failure.
Mm-hmm.
And then the one thing that like I knew I could be successful at, I had to stop doing. So I felt like a complete failure. So it was on so
Yeah.
many levels that like I felt so beat down. And then like the formula shortage happened right as
Oh
I
gosh.
started. So I
Oh.
tried to like relactate. That was a mess. That was a disaster. I don't even know
Oh
why I tried
wow.
to do that. And every time I gave him a bottle, I felt so guilty for feeding him differently than I fed Mina. And it's one of those I had no idea moments because I like when I was breastfeeding, I was talking about how great breastfeeding is. Like I had no idea the potential like damage I was doing to another woman for making the choice to formula feed. And then here I was formula feeding, and it was like, well, why couldn't you have pumped? And it was like, I was, and I hated it.
Yeah.
And I made the choice to stop. And like, if you can't understand that, that's a you problem and not a
Oh
me problem.
totally.
But it still made me feel so bad about myself because I was like, oh my God, like women are so judgmental. Like I almost just lost my life. And you're
Yeah.
coming at me about how I'm feeding my kid. Like, get
Yeah. Oh my
away from
gosh.
me.
Wait, who was this?
It's just random people and like online, and they would make
Oh my
comments,
gosh.
and it's just like, no one in my immediate life said anything. Like Serge made one comment and I lost it because he was just like, oh my God, formula is so expensive. And I just looked at him. I was like, funerals are really expensive.
Yeah.
Just so you know. Like,
Yeah.
and then that was it, and it was easier in the sense that like he got to help feed him and it wasn't always on me. And then I stopped being so angry that he needed to be fed and so
Sure.
frustrated because that's like I dreaded when he would have to eat because I was in so much pain. Like so my theme for his baby shower was like a wolf cub. He was joining the wolf pack and he ate like a puppy. He was like "Nom, nom, 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 nom," and it like just wasn't fun. It wasn't fun. One of my coworkers, Bree, she came to visit me when she was working. She came upstairs and she was like, I was in the room one day when you were nursing Alek and I saw him pull your nipple like all the way out and I was like traumatized. So like I understand why you couldn't do it longer than how you did it. But like, I lasted 3 months and I look back at it and I don't have any guilt over it now, but I had so much of it then. So it's like I'm so sorry for how you were brought into this world. I'm so sorry I suck as a human. I'm so sorry I suck as a mom. I'm so sorry I couldn't breastfeed you. I'm so, there were all these things that I felt personally responsible for. So my postpartum period was actually super miserable.
Yeah.
But it was like I could understand certain things more now because of that.
Sure.
Like I could not for the life of me understand postpartum depression or postpartum psychosis or postpartum anything, or like, how could you have these intrusive thoughts about your baby? And then there I was having intrusive thoughts about my baby, having intrusive thoughts about myself. And I was like, this is not me. And I can't even say that if that experience hadn't happened that I wouldn't have had that. But I'm like, I didn't have it with Mina. So it's more likely I wouldn't have had it with Alek. But I just had so many, like we just got dealt a really crappy hand. And, I spent 11 months home on short-term disability. I was in psychotherapy weekly. I was in PT twice a week. I like couldn't go to work even if I wanted to physically. And then of course emotionally, but also because I was in the doctor 3 times a week, not including Alek's doctors, because he was followed by neurology, he was followed by cardiology, then he was started with early intervention for PT. And the PT was more to like keep eyes on him in case some delay started, because he was diagnosed with a brain injury at birth. He was diagnosed with HIE, and they said severe HIE, which for people that don't know what HIE is, it's hypoxic ischemic encephalopathy. Hypoxic meaning no oxygen. ischemic, meaning injury, and then encephalopathy to the brain. So he was diagnosed with severe HIE.
Oh my gosh.
And I remember thinking, like, what is our life going to look like with a very medically complicated child?
Right.
And you just worry about, all these things. And so we were very fortunate to have a lot of resources at our disposal. I think because I was hospitalized for so long, I got those resources. Typically you have a postpartum period, 24 hours, 48 hours, you're home. And then if you start to develop signs of postpartum depression, by the time you notice it, or postpartum anxiety, your resources are kind of limited. You got to wait to get in for an appointment. Like, my therapist walked into my hospital room.
Oh, nice.
You know what I mean? Like, she was part of the hospital system. She's a perinatal psychologist. They put in a consult. They were like, birth trauma. Come see this patient, and she was thankfully very persistent and came whenever she was on to talk to me. And I was like, I don't want to talk to you. I'm fine. Fine. Because I was like, they're going to lock me up, because my thoughts in the hospital were like, I should be dead. Just kill me. Just kill me. It's just better if I'm dead, because look at me right now. And like, so she was very, very persistent. I didn't want to admit for a long time that there was something wrong with me, even though I knew there was.
Yeah.
The stigma around mental health is crazy. And then people just saying, like, you're so strong. So I was like, yeah, I got to pretend to be strong, because I totally know how to navigate this. I'm so strong. But I like really was. I didn't have a choice. I have a daughter. Like, even if Alek didn't make it, I still have a daughter. Right. So like, what am I supposed to do? So, I fought a lot of silent battles that no one knew I was fighting, because I was still being a mom and being a wife and being a sister and a friend and, all those things. And
those things don't stop.
No, they don't. So like, when do you actually get to heal? You don't. I really didn't like process a lot of what happened to me for like the first year. And then I went back to work.
So you said 11 months, right?
Mm-hmm. I went back last February 2023, right before Alek's first birthday. And I will never work his birthday for the rest of my life. I put in for 3 days, the day before, the day of, and the day after. I won't work. I don't want to be there.
I don't think anybody could blame you for that.
No, I don't want to be there.
Oh my gosh. Well, I'd love to get your perspective then. I know, obviously, you're a healthcare worker. You are also a patient. And we've kind of talked about ways that you can advocate for yourself. And I'd love to hear your perspective on that. Yes. For women going through the healthcare system, pregnant, what would you say are some tips?
I love talking about this. So, I definitely say do your research, but there's a line, right? Because I feel like a lot of people come in when I get them ready to have their babies and they've done like research, but they're ready to fight me about it. You have to be careful where you're getting your information from, because there's a lot of people online on TikTok, which I'm not on TikTok, but people are always like, TikTok this, TikTok that. So TikTok, Instagram, whatever, doulas that aren't healthcare providers, which is completely different from someone just becoming a doula versus like me deciding to become a doula, where I have experience in labor and delivery. And they're going to say things and they kind of make it where you have to fight your nurses and your doctors for what you want. Sometimes you do, but 98% of the time, we want you to have the birth that you want. We are there to help you. But there are things that happen that are beyond our control where we need to intervene to save your life. So I want people to understand that, because they could get so caught up in, well, I read this and this is part of my birth plan. And it's like, you can't always plan, because you know what? That baby is the one who's making the decisions, not you. There's what you want, there's what I want, and then there's what the baby wants. And that's what's going to happen. If your baby's not tolerating labor, you need a C-section, because the constant lack of blood flow to the baby is going to cause brain damage. So, but I just went off on a tangent, but get your information, be informed, ask questions, and do not back down. Don't let somebody tell you that something is normal if you feel like it's not. It's like I talked about earlier, intuition. Trust your gut. And if you feel like your provider is not listening to you, your gut feeling, find another one.
Get a new one. Yep.
You
Yeah,
have
definitely.
to listen to that gut feeling. There's medical advice and there's, online advice and all stuff, but there's a feeling inside of you when you know something is right or wrong. And it could be as crazy as, I feel like I'm going to die in labor. It is a feeling. You need to communicate that to your provider. Some women have different health issues. They have preeclampsia or hypertension or gestational diabetes. Do your research on that, get educated on that, and follow what your doctor's saying, because those conditions, they can turn life-threatening very quickly.
Yeah.
So
Definitely.
it's like, stand firm in what you want. Never feel dumb about asking a question. I always tell my patients, the dumbest question is the one you're not asking. Ask the questions, no matter how ridiculous you think they are, because I will have an answer. And if I don't have the answer, I will find it for you. I would much rather you ask me than don't ask me and then be like, damn, I should have asked that question. Speak up. If you feel like something is not right, speak up. If you don't like the way something is going, speak up. There have been plenty of times where I've said, nope, sorry, we're not doing that. The patient doesn't want it. Even though the patient has strongly verbalized to me, I don't want this, I don't want this, I don't want that. I'm like, okay, we're not doing that. And then the doctor comes in and then they're afraid to speak up. Don't be afraid to speak up, because at the end of the day, this is your labor. This is your birthing experience, not mine, not the doctor's, not your husband's, yours. It is yours. Use your voice. Do not be afraid to speak up and use your voice. And if somebody says that you're difficult, I love when people say I'm difficult.
Yeah.
I'm like, okay. And if you think I'm difficult, it's because you don't have the answers for me, or you don't like people giving you pushback. And I love to give pushback. So if you don't like it and you're going to name me difficult, it just means that you have your one way of doing things and you don't want nobody rocking the boat. And that's not how labor is. Labor is so many different ways. So many different things can happen. We have to be prepared for so many different things. So you should be receptive to patients asking and maybe pushing your medical knowledge a little bit, because not two patients are the same.
Right.
I was completely healthy when I walked in, and then I almost died and almost didn't walk out, so you can't just like take that. I hate that we practice this like blanket care for patients when everyone is so individual and their care is so individual, and every experience is going to be individual, so that's what it is. Speak up, listen to your intuition, get informed, educate yourself, and just don't be afraid to ask questions.
Yes.
Make sure that you go in and you know what to expect. Like, what is your induction process? What methods do you use for cervical ripening? What's your Pitocin titration? Is it 2x2? Is it 4x4? Is it more conservative? What if I don't want Pitocin? Like, I don't want my water broken. Well, we need to, break your water to speed it up. If you don't want it broken, you don't want it broken. And if they do it without your consent, that's assault. So you need to speak up. It's so easy for women to lose their voices in labor because they're so scared, nervous, in pain. Like, make sure you got somebody, whether it's your nurse or your husband or your friend or your doula, that's speaking up for you when you can't.
Yes, definitely. Do you have resources that you would recommend to people?
I'm trying to think of the places that I follow on Instagram, but unfortunately, I just follow a lot of birth trauma places.
Yeah. You want to do a shout out for that?
Yeah, I follow the birth trauma mama, Kaylee Summers. I was on her podcast. I follow Birth Trauma Stories, which is Kathy Garrett. I was on her podcast. I think that people should follow the Golden Hour Birth podcast, the one that I was on, because they have all different kinds of stories. Like, it's not just birth trauma. Like, they have really wonderful birth stories and not so great birth stories. But they're really great. They are really great people.
Yeah, I was on theirs as well.
I know. I listened to your episodes. I think pretty sure just one is Liz is becoming a doula. So she will probably have a lot of resources too. And then I also follow Tila, which is the T on birth trauma. But again, those are birth trauma ones.
Sure.
I follow NICU pages, but I'm always open for any listener to like reach out to me if they feel like they're having, a hard time advocating for themselves. I can give them a script of things that like, that they can say or whatever. Like, I will hook you up. I will write this whole thing, and then they can be like, well, and I read from it, like,
Oh, I love that.
I have a lot of people, that reach out to me and ask me certain things about, L&D and labor, because I'm a labor and delivery nurse, because of my experience. So I'm very open to people hitting me up in my inbox and, trying to find out how they can advocate for themselves. Your OB is going to give you like all these resources, and there's a plethora of information on the internet. You just got to be careful. You just got to be careful. Like if someone's telling you not to go for your scheduled induction date,
and
then you're 44 weeks pregnant, that's not typically going to result in the best outcome,
For sure.
I think that you should vet a lot of the information that you're getting. And also, just, we're not healthcare providers, labor and delivery nurses. We're not your enemy. We don't want to fight with you. We want to help you have your baby, and we love the experience. We love being part of your birth story. We love swaddling those little bundles of joy. I love making the little bow hats for the baby girls. I love helping you learn how to breastfeed, like all those things. We're not there to fight you. We're there to help you, and we're there to make sure that your baby's safe and you're safe.
Definitely.
Yeah.
Love it. All right, Nicolette, thank you so much for coming on.
Thanks for having me.
Of course. Next week, we're going to go through your I had no idea moments throughout parenthood, kind of discuss
what it was
like, right? I can't wait to hear. All the, parenting before having birth trauma and PTSD, and then now, and what that's like for you. And then we'll catch up with where you're at now, back at work and at home. So thank you again. I'm going to put all of your information down in the show notes where people can find you.
Awesome.
So yay. Thank you.
Thank you so much.
Yeah. We'll see you on the next one.
All right. Sounds good. Bye.
Bye. All right, friends. If there was anything that resonated with you today, please go ahead and leave a comment below. Let us know your thoughts. We'd love to hear about it. If you liked this episode, you're really going to like this one too. Check it out.